Hi, everybody. Today we are going to read The Immortal Life of Henrietta Lacks. We are going to read the chapter entitled Illegal, Immoral, and Deplorable. Deplorable. Somebody write that on your board. What does the word deplorable mean? Today we're going to find a bunch of vocabulary words that we might not know at all, that we have never seen. So while we're reading, what somebody needs to do is anytime you're like, what is that word? It doesn't matter if you know how to spell it. Doesn't matter. Somebody write it on the board or put it on a sheet of paper. And after I'm done reading, go look up all these words and see what they are. Okay? So we're going to read about something that may be ethical, may not be ethical. Remember our conversation yesterday on ethics? Okay, let's read. Oh, you will also notice a cat every once in a while. I apologize, but she may show her face. Okay, here we go. As HeLa grew like crabgrass in laboratories around the world, a virologist named Chester Southam had a frightening thought. What if Henrietta's cancer cells could infect the scientists working on them? Gay and several others had already shown that some rats grew tumors when injected with live HeLa. Why not humans? Researchers were breathing in the air around HeLa cells, touching them and transferring them from vial to vial, even eating lunch at lab tables besides them. One had used them to grow a vaccine for a common cold-like virus, which he's injected along with bits of HeLa into more than 400 people. Yet no one knew whether a person could actually catch cancer from HeLa or other cancer cells. There is a possible danger, Southam wrote, of initiating neoplastic disease by accidental inoculation. Somebody put inoculation on the board. What in the world is that? During laboratory investigations or by injection with such cells or cell products if they should be used for production or virus vaccine. Hey, another thing is you can always stop this video too if you need to take a pause to write a word on the board. Southam was a well-respected cancer researcher and chief of virology at Sloan Kettering Institute of Cancer Research. He and many other scientists believed that cancer was caused by either a virus or an immune system deficiency. So Southam decided to use HeLa to test those theories. In February 1954, Southam loaded a syringe with saline solution mixed with HeLa. He slid the needle into the forearm of a woman who'd recently been hospitalized for leukemia, then pushed the plunger, injecting about 5 million of Henrietta's cells into her arm using a second needle. Southam tattooed a tiny speck of India ink next to the small bump that formed at the HeLa injection site. That way he'd known what to look for when he re-examined the woman days, weeks, and months later to see if Henrietta's cancer was growing on her arm. He repeated this process with about a dozen other cancer patients. He told them he was testing their immune systems. He said nothing about injecting them with someone else's malignant cells. Is this ethical? Is this not ethical? Do you remember our conversation yesterday? All right, somebody write malignant on the board and pause the video to do so. Okay, within hours, the patient's forearms grew red and swollen. 5 to 10 days later, hard nodules, what is a nodule, began growing at the injection site. Southam removed some of the nodules to verify that they were cancerous, but he left several to see if the patient's immune systems would reject them or the cancer would spread. Within 2 weeks, some of the nodules had grown to 2 centimeters, about the size of Henrietta's tumor when she went in for her radium treatments. Southam eventually removed most of Henrietta's tumors, and those he didn't remove vanished on their own in a few months. But in 4 patients, the nodules grew back. He removed them, but they returned again and again. In one patient, Henrietta's cells metastasized to her lymph nodes. Okay, those are some big words. Metastasized and lymph nodes. That might be board worthy. Since those patients had all had cancer to begin with, Southam wanted to see how healthy people reacted to the injections for comparison's sake. So in May 1956, he placed an ad in the Ohio State Penitentiary newsletter. Okay, penitentiary. What does that word mean? Physicians Week 25 volume for cancer research. A few days later, he had 96 volunteers, which quickly increased to 150. He chose the Ohio prison because its inmates had cooperated in several other studies without resistance, including one in which they'd been infected with a potentially deadly disease caused tularemia. Research on inmates would come under scrutiny and start being heavily regulated about 15 years later because they'd considered a vulnerable population unable to give informed consent. But at the time, prisoners nationwide were being used for research of all kinds, from testing chemical warfare agents to determining how X-raying testicles affected sperm count. Southam began injecting prisoners in June 1956 using HeLa cells that his colleagues Alice Moore carried from New York to Ohio in a handbag. 65 prisoners, murderers, embezzlers, robbers, and forgers lined up on wooden benches for their injections. Some wore white hospital garb. Others came off work gangs wearing blue dungarees. Dungarees! What is a dungaree? That might go on the board for a vocab word. Soon tumors grew on the prisoners' arms just as they had grown in the cancer patients. The press ran story after story about the brave men at the Ohio Penitentiary, aka prison, praising them as the first healthy human beings ever to agree to such rigorous cancer experiments. They quoted one man saying, "I'd be lying if I said I wasn't worried. You lie there on your bunk knowing you've got cancer in your arm. Boy, what do you think about? Boy, what you think about." Again and again, reporters asked, "Why did you volunteer for this test?" The prisoner's reply were like a refrain. "I done a girl a great injustice, and I think I'll pay back a little bit what I did to her. I believe the wrong that I have done in the eyes of society. This might make a right on it." Southam gave multiple cancer cell injections to each prisoner, and unlike the terminally ill patients, those men fought off the cancer completely. And with each new injection, their body responded faster, which seemed to indicate that the cells were increasing in inmates' immunity to cancer. Immunity. What does immunity mean? When Southam reported his results, the press hailed them as a tremendous breakthrough that they could someday lead to a cancer vaccine. In the coming years, Southam injected HeLa and other living cancer cells into more than 600 people for his research. What? Sorry, we're going to find out what happened there. Here we go. This is where we are. Of them cancer patients. He also began injecting them into every gynecologic surgery patient who came to Sloan Kettering's Memorial Hospital, or its James Ewing Hospital. If he explained anything, he simply said he was testing them for cancer. And he believed he was. If he explained anything, he simply said he was testing them for cancer. And he believed he was. Since people with cancer seem to reject the cells more slowly than healthy people did, Southam thought that by timing the rejection rate, he might be able to find undiagnosed cases of cancer. In a statement he later repeat again and again during hearings about his research, Southam wrote, "It is, of course, inconsequential whether these are cancer cells or not, since they are foreign to the recipient and hence are rejected. The only drawback to the use of cancer cells is the phobia and ignorance that surrounds the word cancer." Being of that phobia and ignorance, Southam wrote, he didn't tell patients the cells were cancerous because he didn't want to cause any unnecessary fear. As he would say, to use the dreaded word cancer in connection with any clinical procedures on an ill person is potentially, how are we going to pronounce that word? Deleterious? I'm not sure. We'll have to look that up. To that patient's well-being. Being is because it may suggest to him, rightly or wrongly, that his diagnosis is cancer or the prognosis is poor. What does prognosis mean? Man, we're hitting all these vocabulary words today. To withhold such emotionally disturbing but medically non-pertinent details, non-pertinent, woo! Let's write that on the board too, is the best and most tradition of responsible clinical practice. But Southam wasn't their doctor, and he wasn't withholding upsetting health information. The deception was for his benefit. He was withholding information because patients might have refused to participate in his study if they'd known what he was injecting. And Southam probably would have continued doing this for years had he not made an arrangement on July 5th, 1963 with Emmanuel Mandel, director of medicine at the Jewish Chronic Disease Hospital in Brooklyn, to use the hospital's patients for his research. The plan was that Mandel would have doctors on his staff inject 22 JCDH patients with cancer cells from Southam. But when he instructed his staff to give the injections without telling patients they contained cancer cells, 3 young Jewish doctors refused, saying they wouldn't conduct research on patients without their consent. All 3 knew about the research Nazis had done on Jewish prisoners. They also knew about the famous Nuremberg trials. And that is where we're going to end today because we have a lot of vocabulary words to figure out. And I want you to spend some time getting all of those down. And then we will pick up here and go back and talk about how Nazi Germany is relative to this situation with Henrietta Lacks. Also, how is any of this ethical or not ethical? And what would they need to do to turn something like all of this that possibly that you all consider not ethical? Or, I consider it not ethical. How would we turn it and make it ethical? Let's discuss.